What if I told you that a simple golden oil used by our ancestors for thousands of years might hold the key to reigniting the spark that made you feel truly alive as a man? What if this natural remedy could address the silent struggles that countless men over 60 face but rarely discuss openly? Today, we are going to explore something that pharmaceutical companies do not want you to discover: a time-tested approach that works with your body, not against it. Welcome to Vital Hormone, where we unlock the secrets of natural vitality and wellness. I am Dr. Evelyn Hart, and for over 2 decades, I have dedicated my practice to helping mature men reclaim their confidence, energy, and intimate connection. Throughout my years as a physician, I have witnessed thousands of men struggle with changes they never expected, changes that affect not just their physical health, but their entire sense of identity and masculinity. Today, we are diving deep into one of nature's most misunderstood remedies: castor oil. We will explore the fascinating science behind circulation and nerve health, examine how inflammation silently sabotages male vitality, and most importantly, I will share with you exactly how to harness this ancient remedy safely and effectively. Let me share something that might surprise you. In my practice, I have noticed that the most successful, accomplished men often carry the heaviest burden of silence when it comes to their intimate health. Just last month, a distinguished gentleman named Michael, a 72-year-old retired executive, sat in my office with tears in his eyes. He told me something I hear almost daily: "Doctor, it just does not work the way it used to. I feel like I am losing myself." Michael was describing what millions of men experience, but few dare to discuss: the gradual decline in blood flow, the loss of natural firmness, and that vibrant sense of masculine aliveness that once felt effortless. This transformation does not happen overnight. It creeps in slowly, like shadows lengthening at sunset. Our arteries begin to lose their youthful flexibility. Blood vessels gradually narrow. The production of nitric oxide, that crucial molecule responsible for healthy circulation, starts to diminish with each passing year. What once felt natural and automatic suddenly requires conscious effort, and eventually, even that effort seems insufficient. To understand how castor oil might help, we must first understand what is happening inside your body. Nitric oxide serves as your body's master key for vascular health. This remarkable molecule acts as a chemical messenger, signaling the smooth muscles in your penile blood vessels to relax and allow increased blood flow. When nitric oxide levels decline, and they inevitably do with age, your blood vessels constrict, response times slow down, and the firmness you once took for granted begins to fade. Research published in major medical journals reveals startling statistics. Between 30 and 50% of men aged 40 to 70 experience some degree of erectile challenges. For men over 70, this number jumps to more than 60%, facing moderate to severe difficulties. These are not just statistics. They represent real men, real relationships, and real emotional pain. But the challenges extend far beyond simple blood flow issues. Many men develop a condition called Peyronie's disease, where fibrous scar tissue builds up inside the penile chambers. This creates curvature, shortening, or uncomfortable pulling sensations. The Mayo Clinic explains that traditional medical treatment often involves collagen-dissolving injections or surgical interventions, approaches that feel invasive and frightening to many men. Adding to this complex picture is chronic low-grade inflammation. Your body's natural inflammatory response, designed to protect and heal, can become persistently active in sensitive tissues. This ongoing inflammation interferes with healthy blood flow, reduces tissue flexibility, and accelerates the breakdown of vital structures. Men describe it as a burning sensation, persistent tightness, or the uncomfortable feeling that everything is gradually shrinking. There is another layer to this story that most men never consider: the health of their skin. As we age, the delicate skin of the genital region undergoes dramatic changes. Hormone levels decline, oil-producing glands become less active, and the skin loses its natural elasticity and moisture. The Cleveland Clinic emphasizes that adults over 65 face significantly higher risks of dry skin complications. When this delicate skin becomes dry and fragile, it develops microscopic cracks and tears. These tiny wounds not only cause discomfort, but create entry points for bacteria and irritants, leading to infections or chronic dermatitis. The result is a vicious cycle where inflammation leads to more dryness, which leads to more damage, which leads to even greater inflammation. This brings us to castor oil, a thick golden oil extracted from the seeds of the Ricinus communis plant. For thousands of years, traditional healers have recognized castor oil's unique properties, though modern medicine has approached it with considerable skepticism. The primary active component is ricinoleic acid, a monounsaturated fatty acid that comprises nearly 90% of the oil's composition. Now, I must be completely transparent with you. Major medical organizations, including the Cleveland Clinic and WebMD, emphasize that most health claims surrounding castor oil lack robust scientific evidence. The only FDA-approved use remains temporary constipation relief, and there are genuine risks, including potential skin irritation, allergic reactions, or digestive upset if consumed inappropriately. However, recent animal studies published in Mediators of Inflammation have revealed fascinating insights. Researchers discovered that ricinoleic acid demonstrates significant anti-inflammatory and pain-relieving properties when applied topically. In these studies, repeated application reduced tissue swelling and suppressed substance P, a neuropeptide involved in pain transmission. While these findings cannot be directly translated to human experience, they suggest intriguing possibilities for addressing the inflammatory component of male vitality challenges. Based on my clinical experience and the available research, I have identified 5 potential pathways through which castor oil might support male vitality. Let me walk you through each one, sharing real patient experiences and practical insights. Pathway 1. Revitalizing blood flow. Healthy circulation forms the foundation of masculine vitality. When you massage warm castor oil into the pelvic region, several beneficial processes occur simultaneously. The mechanical pressure and warmth cause small blood vessels to dilate, increasing local circulation. Patients consistently describe a pleasant warming sensation or gentle tingling that develops within minutes of application. This likely reflects improved microcirculation rather than any systemic effect. Robert, a 68-year-old patient, told me after 6 weeks of consistent use, "I notice a difference in how things feel down there. There is more life, more warmth. It is subtle, but it is real." This enhanced blood flow creates a more favorable environment for natural response and sensation. Pathway 2. Addressing tissue flexibility. One of the most distressing changes men notice is increased curvature or a sensation of tightness during arousal. While severe cases require medical intervention, many men experience milder tissue stiffness caused by subclinical microscarring or collagen deposition. The anti-inflammatory properties of ricinoleic acid may help address this issue by reducing excessive fibroblast activity, the cells responsible for scar tissue formation. In my practice, I have observed that men with mild curvature or tightness often report gradual improvement after several months of regular castor oil massage combined with gentle stretching exercises. The key lies in consistency and patience as tissue remodeling occurs slowly over time. Pathway 3. Calming hidden inflammation. Chronic inflammation represents a silent destroyer of male vitality. Many men experience persistent low-grade inflammation in pelvic tissues without realizing it. They describe burning sensations, uncomfortable tightness, or the troubling feeling that everything is gradually shrinking. This inflammation can result from recurrent infections, unaddressed skin conditions, friction from clothing, or underlying metabolic disorders. The anti-inflammatory effects of ricinoleic acid, demonstrated in animal studies, may provide meaningful relief. The oil's thick consistency forms a protective barrier that shields delicate tissues from further irritation, while the massage process encourages lymphatic drainage and reduces inflammatory mediators. James, a 71-year-old patient, reported after 2 months of use, "That burning feeling I had been dealing with for years is finally gone. I did not realize how much it was affecting my comfort until it disappeared." Pathway 4. Supporting nerve health and sensation. Perhaps the most heartbreaking complaint I hear from mature men is the loss of sensation. Thomas, a 73-year-old gentleman, once told me through tears, "I can still function, but I cannot feel it the way I used to. It is like my body is going through the motions while my mind watches from a distance." Nerve health depends critically on adequate blood flow and minimal inflammation. Diabetes, hypertension, certain medications, previous surgeries, and chronic inflammation can all damage the delicate nerve fibers responsible for sensation. While castor oil cannot regenerate damaged nerves, it may create conditions conducive to nerve recovery by improving local circulation and reducing inflammation. Equally important is the mindfulness aspect. When men take time to gently massage their pelvic region with intention and care, they often rediscover subtle sensations they had previously overlooked. This enhanced body awareness can reignite the mind-body connection essential for pleasure and satisfaction. Pathway 5. Protecting and nourishing aging skin. The skin of the genital region requires special attention as we age. Declining hormone levels and reduced oil gland activity cause this naturally thin and sensitive skin to become increasingly dry and fragile. The Cleveland Clinic warns that dry skin in older adults frequently cracks and bleeds, creating entry points for infection and increasing discomfort. Castor oil's exceptional moisturizing properties stem from its unique molecular structure. Rich in ricinoleic acid and other fatty acids, it helps restore the lipid barrier that holds skin cells together. Its thick consistency enables it to form a protective layer that locks moisture into the skin for extended periods. Regular moisturization with high-quality castor oil can transform the health and appearance of aging genital skin. Men report increased comfort, reduced irritation, and greater confidence during intimate moments. However, it is crucial to choose pure, cold-pressed castor oil and always perform a patch test before initial use. Now that you understand the potential benefits, let me guide you through the safe and effective use of castor oil. Proper technique makes all the difference between success and frustration. Choose only 100% pure, cold-pressed castor oil, without additives, fragrances, or preservatives. Avoid industrial or refined oils, which may contain harmful impurities. For sensitive skin, consider diluting the castor oil with an equal amount of sweet almond oil or jojoba oil to reduce thickness and potential irritation. Before applying castor oil to sensitive areas, perform a patch test on less sensitive skin, such as your inner forearm. Apply a small amount and wait 24 hours. If you observe any redness, itching, or irritation, do not proceed with genital application. This simple test can prevent uncomfortable reactions. Transform your castor oil application into a mindful healing ritual rather than a mechanical procedure. Begin by gathering your supplies: pure castor oil, a small bowl of warm water, a clean towel, and optionally, a heating pad set to low temperature. Warm the oil by placing the bottle in warm water for several minutes or by rubbing a small amount between your palms. Warm oil penetrates skin more effectively and feels more soothing during application. Apply a small amount, just a drop or two, to the shaft, base, and surrounding pubic area. Use slow, circular motions with light pressure for 3 to 5 minutes. Focus on relaxation and mindfulness rather than goal-oriented expectations. This is not about forcing results, but about nurturing your body with gentle care. After massage, apply a warm, damp towel over the treated area for 15 to 20 minutes. The gentle heat increases circulation and helps the oil absorb more deeply. Alternatively, use a heating pad on the lowest setting, but never fall asleep with a heating pad in place. Concise. Stency trumps intensity in this practice. Aim for 3 to 4 applications per week, preferably before bedtime when your body naturally enters its repair and recovery phase. Continue this routine for at least 4 to 6 weeks before evaluating results, as tissue changes occur gradually over time. Keep a simple journal noting changes in blood flow, sensation, comfort level, and emotional response. This record will help you track progress and identify what works best for your unique situation. While castor oil may offer supportive benefits, it is not a replacement for professional medical care. You must consult with a urologist or primary care physician if you experience persistent erectile dysfunction, pain during arousal, significant curvature, unexplained swelling, or changes in the appearance of your genitals. Conditions such as Peyronie's disease, hormonal imbalances, prostate disorders, diabetes, or cardiovascular disease require proper medical diagnosis and evidence-based treatment. Medications like PDE5 inhibitors, specialized injections, vacuum devices, and surgical interventions have strong research support for their effectiveness. Think of castor oil as one component of a comprehensive health strategy, not as a standalone solution. It should never delay appropriate medical evaluation or treatment of serious conditions. Working with mature men for 2 decades has taught me that intimate health extends far beyond physical mechanics. When sexual function changes, men often withdraw emotionally, avoiding physical closeness for fear of embarrassment or failure. Partners may misinterpret this withdrawal as loss of desire, creating emotional distance in relationships that were once close and connected. The castor oil ritual offers something profoundly healing beyond its physical effects. It provides an opportunity for mindful self-care and body reconnection. Sever. Our patients have described how this practice helped them rediscover appreciation for their bodies and reduce the anxiety surrounding intimate encounters. Marcus, a 69-year-old patient, shared this insight. At first, I felt foolish massaging oil on myself, but after a few weeks I realized I was actually taking time to care for my body in a gentle way I had never done before. It became a form of self-compassion that changed how I felt about aging and my sexuality. Some couples have even incorporated this practice into their shared intimacy, turning it into a moment of connection and mutual care. This transformation of a solitary health practice into a bonding experience demonstrates the profound healing potential of approaching intimate health with openness and creativity. To maximize the potential benefits of castor oil, integrate it into a comprehensive vitality plan that addresses all aspects of male health. Cardiovascular foundation: maintain healthy blood pressure, cholesterol levels, and blood sugar. Your intimate health directly reflects your overall cardiovascular wellness. Nutritional support: consume a diet rich in nitrate-containing vegetables like beets, leafy greens, and citrus fruits to support natural nitric oxide production. Antioxidant-rich foods combat the inflammation that undermines vitality. Movement and exercise: engage in at least 150 minutes of moderate aerobic activity weekly. Exercise boosts nitric oxide production, improves blood vessel function, and enhances mood and confidence. Stress mastery: chronic stress activates your sympathetic nervous system and constricts blood vessels, directly interfering with healthy sexual function. Incorporate mindfulness, meditation, yoga, or deep breathing exercises into your daily routine. Sleep optimization: poor sleep reduces both testosterone and nitric oxide production, both essential for sexual health. Prioritize 7 to 8 hours of quality sleep nightly. Hydration and skincare: drink adequate water and protect your skin with appropriate moisturizers. Healthy skin supports healthy nerve function and overall comfort. Open communication: share your experiences with your partner and explore new ways of connecting both physically and emotionally. Intimacy encompasses far more than sexual performance. Remember, you are not walking this path alone. Millions of men face similar challenges, and there is no shame in seeking natural, gentle approaches to support your health and vitality. Castor oil may not be a miracle cure, but it represents something equally valuable: a return to trusting your body's innate healing wisdom and treating yourself with the care and respect you deserve. Your vitality is not defined by a single aspect of your health, but by your commitment to nurturing every part of yourself with patience, knowledge, and compassion. Take that first step today, and remember, true healing happens not through force, but through consistent, loving care. Thank you for joining me on Vital Hormone today. If this message resonated with you, subscribe to our channel and share this information with someone who might benefit. Together, we can break the silence surrounding men's health and empower each other to thrive at every stage of life.